You are listening to Seniors Junction podcast. Your hosts today, Namrata Bagaria and myself, Paul Merkley, co-founders of Seniors Junction, and our very special guest today, Kate Dupuis. She is the Schlegel Innovation Leader in Arts and Aging at Sheridan College. Thank you for coming. Welcome.
Thank you so much for having me.
Okay, we are working to prevent seniors isolation one conversation at a time. Could you tell us a little bit about yourself and what you do?
Absolutely. I'm a clinical neuropsychologist, which means I'm a psychologist who specializes in disorders of the brain. And I work primarily with older individuals. So individuals, for example, experiencing neurodegeneration due to dementia, such as Alzheimer's disease, and those who care for them. And in my role at the Sheridan Center for Elder Research, I really focus my work on looking at how we can help older individuals access the arts. There's a huge body of literature that suggests the arts can be very beneficial for our health and well-being across the lifespan, but even more so perhaps as we age. And so my focus really is on that intersection of arts, health, aging, and how we can encourage people and provide access to the arts for our rapidly growing aging population here in Canada and beyond.
Thank you. We were learning yesterday of the statistic that we add 100,000 seniors every year to the demography, 100,000 new seniors. Thanks.
Yeah. And I think we were fortunate to have both your directors, past and present, come at one point in our podcast. So it's exciting to continue the conversation with you. And so in your work, you must have encountered senior isolation, especially social isolation. And I wanted to know, according to you, what are the pain points?
Absolutely. I mean, even before COVID, social isolation and seniors isolation was a major issue that we attempt within our center to tackle. There's, of course, always some trouble with working in this field, because if people are isolated, how do you get to them? How do you actually reach out to people that are hard to find or are staying home or are within their own perhaps small bubble and not able or not willing, or for whatever reason, not currently accessing other activities and opportunities? So it's actually been really interesting during COVID to see, from my own perspective, how many arts organizations so quickly moved to online programming and to the use of technology to reach out to people, because then, of course, you're actually getting over quite a few of the barriers that we were potentially seeing prior to the pandemic. So in my own research, when I've looked at sort of community dwelling older adults, so individuals who live in their own homes or in homes with families, not in retirement homes or long-term care, when we would look at the pain points in terms of accessing the arts, it was often things like transportation, cost, not having someone to go with. So actually, your social isolation then sort of builds upon itself and makes you even less likely to reach out. But a lot of those things we're able to overcome now. A lot of opportunities are low or no cost through the internet. People don't need to travel anywhere, especially in Canada in the winter. That's really helpful that you don't need to get in your car and try and, get all the snow off your car and then find the parking and use the parking meter without your mittens on and it's really cold. And people can also access it from home, maybe with other people they're living with. So one of the things that we've noticed is, especially individuals who are caring for someone at home, so providing care, it's difficult to leave the house, right? To go to an activity. So even though you're there with someone providing care all the time, that doesn't prevent the isolation. It actually might even make you more isolated because, yeah, you want to go with your friends to the theater, but who's going to watch your husband? Well, now you can actually go to the theater. I'm using quotes here. You can go to the theater on your computer and maybe be talking to your friends on the phone or texting them while you're watching the experience together, and you're still providing that care for your loved one at home. So many of the pain points that we saw before in terms of, within that arts and health space, I think some organizations are helping to try and address them. But of course, the one that does still continue, and I think is especially more so during COVID, is technology, right? We're here today through the magic of Zoom in different places. A lot of older adults don't have access to technology. They may not have the the money to pay for or even depending on where they are in the country, be able to access high-speed internet. So they can't get into the programming, or they perhaps are cognitively or physically unable to access the programming because they can't necessarily work the device. So there absolutely are still a number of pain points, but we're hoping that, with a lot of people moving online, we are able to at least access a few more folks who weren't getting to the arts prior to this.
Thank you. So you've already touched on or addressed part of this, but is there anything else you'd like to say about your vision for tackling the problem?
Well, absolutely. We don't really, at the center, we don't really focus so much in terms of what are the benefits, or trying to prove, you might say, that there are benefits of the arts to an older population. We have seen that there are an incredible number of studies that have shown the arts can be so beneficial. So one of the questions that we try and tackle is, okay, so starting at the point where the arts may help your social well-being, your emotional well-being as you get older, how can we increase your access to the arts? So some of the things that we're hoping for from a vision perspective are to have more support really at a more structured level across the country for a focus on the arts. Arts have typically been undervalued and underfunded. You see that even starting in the school system, right? Where money gets taken out of music classes, art classes. So one of the things that we're hoping to do is really try to form a network across the country that will help us really connect people who are like-minded and who are doing great work in the arts, health, and aging space. To that end, we have an annual day. It's our second annual day this year, called Arts and Aging Day Canada, where we're partnering with different organizations across the country to offer no-cost arts programming to anyone who wants to join us through Zoom. So trying to tackle those barriers, trying to get people out of their own silos and reduce that seniors isolation. We also have a number of ongoing projects at the center where we work with different community organizations to help them evaluate and expand existing programming. So it's always nice, when you think of it from a vision perspective, to have that evidence for the benefits of your program. Funders really like to see evidence. So trying to work with as many community partners as we can who are already offering this type of programming, and to help them develop their own perhaps tools to evaluate the success of their programming so that they can continue to be funded and continue to reach out to those individuals. I'll give you one particular example. During the pandemic, we've been working with a local arts organization in Oakville, Ontario, who had noticed that within their own population, there was a lot of social isolation in their older artists or older art students, but also in some of the younger students who were living with disabilities. And so they recognized that these were two groups that were quite vulnerable to that isolation. And they created an intergenerational visual arts class where the kid, I call them kids because they're in their 20s, but the younger adults and the older adults who had expressed sort of being alone, being isolated, low mood, not feeling great, were able to come together twice a week for 2 hours and make art together. This is not a huge high cost. You're paying for obviously the time of the artists, the instructors. You're paying for high quality materials, so people are producing beautiful art. But it's an opportunity for people to come together and to form that community and to build connection, which I think we all need right now more than ever.
Thank you.
Thank you. And thank you for sharing what you do. And it sounds very interesting, but it's full of the fine print is not that easy, in my opinion. So what are the barriers that you faced or are facing, and what are the opportunities?
Well, absolutely. One of the barriers that we face is always funding, right? For what I'm very mindful of in my own work is trying to harness the power of what's already being done in the community around the arts, health, and aging space. I once read a study that suggested that about 80% of the papers that have been published showing the benefits of the arts for an older population, for their social well-being, for decreasing isolation, those were papers where a researcher had come in, had offered some sort of arts-based intervention, and at the end of the 8 or 12 weeks, did a final test on the participants and then said, okay, bye. So that, to my mind, obviously is important because it provides us with even more evidence of the importance of the arts as we age, but it's not a sustainable opportunity for people. And so you're offering people who perhaps seniors who are isolated, you're offering them this great opportunity to connect with people and to develop a community. And then at the end of the time, you say, okay, sorry, that's it, we're done. We have no more money for this. So the number one barrier, I think, in a lot of this is funding. So accessing the money to pay trained artists, right? We want to have high quality art instruction from musicians, dancers, visual artists, multimedia artists. It could be, anyone, but it's very important that we support artists and we fund them appropriately. So that's one major barrier. Obviously, during COVID, getting together in person is a major barrier. So we've moved a lot of our programming online. We have an intergenerational music therapy project we do in long-term care. We actually were able to move that onto Zoom, surprisingly. So you have, a 4-month-old baby zooming into a long-term care home and singing along with the residents. So I think people have been really generous with their time and really creative and innovative in terms of, how to get funding during this time and how to move in-person programming to a virtual space. So that's been quite incredible to see. But really, I think in my mind, one of the, the major barriers, the major pain point to making access to the arts for an older population more sustainable is funding.
Thank you. And what advice would you have for a company like ours?
Well, I would say, harnessing the power, not only necessarily of these sort of quote unquote arts, but people's creativity and people's expression. So bringing people together through the arts is fantastic. But what you'll find probably is that there's a certain segment of the population, and we have some research we're doing on this right now, that hears the word arts and thinks, ooh, that's not for me. I can't carry a tune in a bucket, or I have 2 left feet. I can't do something like that. So that's not a way for me to connect with other people. So one of the things that I like to do within my own work is to talk more about people's creativity or people's ability to express themselves. So, maybe some of the people you work with are master chefs, or they're really good at gardening. All of these are ways to express oneself and ways to connect with other people around shared interests. And really, that's what it's all about in terms of tackling seniors isolation is how do you find like-minded individuals who can come together and connect over something shared, right? Humans are at our very basic nature. We're social creatures. That's how we originally were able to survive because we were in groups. We all want to reach out to people and be around people that like the same things as us. And we also like to learn from people, right? So tackling seniors isolation, not only by bringing people together to share common interests, but to learn and grow from one another, I think can be a really, really powerful way of creating that connection and forming new communities.
Thank you.
Thank you. And if people want to find out more about your organization and your work, how can they find you?
I would love for them to reach out. So they can find me at the Sheridan Center for Elder Research, which is at Sheridan College in Oakville, Ontario. They can also find me on Twitter. My Twitter handle is Dr. Kate T.O. So T.O. for Toronto. And they can also follow a second Twitter handle if they'd like. It's called @ArtsAging. So ARTS and then the word aging. So it's all those 2 words together. And that's really a space where I'm trying to connect people across the country and really actually starting to be a bit more internationally now, who are all really interested in this intersection between arts, health, and aging, and how we can use that to tackle important issues such as seniors isolation.
Thank you. Thank you so much.
Thank you very much.